Hi, everybody. Welcome back. Thank you for being here. We have with us today a truly wonderful guest, and it's my honor to introduce Susan King to you. Hi, Susan.
Hello, Sonia. Thank you.
Thanks for being here. Susan is actually with Oregon's Nurses Association. She's going to be talking to us about the new changes that affect you in terms of primary care, in terms of the benefits they're going to be getting. And but then before I begin, why don't I ask you, what is ONA? What's Oregon Nurses Association? What does it do?
The Oregon Nurses Association is the professional association and labor union for registered nurses in the state of Oregon. We were founded in 1904, so we're pretty old. We've been doing this a while. And our purpose is to represent the profession of nursing and advocate for quality health care. Awesome. Obviously, appropriate topic today.
Very much so. And you are the executive director.
I'm the executive director, yes.
We had the hardest time keeping in touch with her because she's always busy. She's always on the road. And what does it entail being an executive director of such an organization?
I report to a board of directors, all of whom are nurses. And my responsibility is to carry out the goals and directives from our 12,000 nurses across the state.
Oh my.
And I get to do very fun things, such as lobbying for the Affordable Care Act in Washington and in Salem.
That's fun. So today's topic is Obamacare. There's a push towards, like we mentioned before, more preventative approach to healthcare. So can you please tell our viewers what kind of changes to expect with regard to their primary care?
Well, the intent of the Affordable Care Act and the work that's being done here in Oregon is really to help individuals and their families stay well, get well, or manage chronic illnesses successfully. And to do that, we in Oregon and through the Affordable Care Act have placed a great deal of emphasis on what we're calling the primary care home.
Okay. What's that?
What is a primary care home? Good question. A primary care home is a group of professionals or an individual professional. So in some cases it might be a nurse practitioner out in Enterprise, Oregon, who has her own clinic. Or in some cases it might be a group of professionals, a nurse practitioner, a physician, nurses, mental health specialists, pharmacists, who are, their practice is really designed to interact with individuals and their families over time and build a relationship that involves keeping them healthy or helping them stay healthy.
Interesting. And that doesn't exist right now, correct?
Well, we've had primary care for a long time. And actually, I like to think about when I was growing up here in Portland, my family had a family physician, and my family's physician employed a nurse named Shirley, and actually she ran the place.
Oh, nice.
She did everything. She made home visits, she taught, she gave us advice, and so I really think that our primary care home is just the newest version of what I lived with when I was growing up in the 50s.
Got it, got it. It is wonderful that there is more of a push towards preventative medicine.
Yes.
And it's really great that nurse practitioners are going to be in the forefront of this. Really excited about that. So some of the essential benefits of this new law have become very politicized. Can you shed some light on that for us?
Well, I think probably the issue of essential benefits has been misrepresented or is unclear in the minds of the public, and certainly since you've been out interviewing, I'm sure you're hearing that.
Right.
The 10 essential benefits under the Affordable Care Act, again, are aimed at helping people stay healthy. So there's a great emphasis on no cost payment, no first dollar coverage is what they call it, for the U.S. Preventive Health Services interventions, such as, pap smears, mammograms, those kinds of things. And so the essential benefits really are an attempt for us to say any plan that is offered in this country will have to be built around the things that we know make a difference in people's health.
Got it. That's pretty awesome. So are there any parts of this law that you think would directly affect, the Americans who are in the workforce?
Yes, I think there are two ways that the Affordable Care Act will affect the workforce. First and foremost, there are a number of provisions within the Act that actually provide incentives, mostly in the form of money, for individuals, nurses, nurse practitioners, physicians, again, to go into primary care, often in underserved areas or with people who haven't traditionally had access to health care. And so there are a number of workforce provisions in the Act. Secondarily, we all know people who stay in jobs because that's where they get their health insurance. And if they're unhappy, they're afraid to leave because they would no longer have health insurance. And in some cases, once they leave a group plan, they wouldn't qualify as an individual because they had even a minor pre-existing condition. So I think two big immediate changes are the assistance that the Act will give to incent the kind of care we want, and secondarily so that people have options to get health insurance.
Oh, that's really, truly wonderful. And you know, we mentioned before that nurse practitioners are going to be in the forefront of this with the primary care and everything. Can you explain to them, do nurse practitioners work for physicians here in the state of Oregon? Are they assistants to doctors here?
They are not. Nurse practitioners in Oregon have a very long history of independent practice. And I'm very proud because the Oregon Nurses Association has lobbied successfully over the years, beginning in the middle 1970s, to establish nurse practitioners as primary care and specialty providers. They are independent. They prescribe medications. They consult with their physician colleagues, just like physicians do.
Very nice.
And they're a growing part of our workforce.
That's really great. And a lot more insurance companies are providing compensation, I hope.
That's correct, yes.
Yeah. Very, very nice. Well, that's all the questions we had for you today.
Well, I've enjoyed talking with you. And
it's been great.
It's going to be great to see the act.
Thank you.
Yeah,
I truly appreciate the support.
Thank you for inviting me, Sonia. I appreciate it.
Thank you.
Nice to see you.
Nice to see you.